Today, we're going to play medical detective. We're cracking open a really complex case with some truly baffling symptoms. And our entire investigation, well, it kicks off with one simple question.
So picture this. A patient walks in with this collection of symptoms. On the surface, they seem totally unrelated, right? It's a real puzzle. What single culprit could possibly be responsible for such a huge range of problems? This is the central mystery we're diving into today.
Okay, so these are our first clues. The body starts moving fat around in these really specific ways, to the belly, the face, and the upper back. That's where you get the classic moon face and buffalo hump from. But at the same time, proteins in the skin are breaking down, which leads to thinning skin, easy bruising, and those very distinct deep purple stretch marks. It's a super confusing picture. And honestly, this is just the beginning.
And here it is, our culprit. The one common thread that ties all those completely different clues together is a single hormone, cortisol. When your body gets flooded with way too much cortisol for way too long, it just throws multiple systems into complete chaos. And that chaos, that's the clinical state we know as Cushing syndrome. So how is this whole thing supposed to work when it's, working correctly? Think of it like a smart thermostat system in your house. Your hypothalamus is the thermostat. It senses when you need some cortisol and sends out a little signal. The pituitary gland, that's the controller. It gets that signal and then tells the adrenal glands, which are like our furnace, to fire up and produce cortisol, the heat. This whole command chain is called the hypothalamo-pituitary-adrenal axis, or HPA axis for short.
Normally, your cortisol has this really nice daily rhythm. It's highest in the morning, that's what gives you that burst of energy to wake up and get going. Then it drops to its lowest point at night so you can rest. But in Cushing's, that whole rhythm is shattered. The levels are just stuck on high all the time. This loss of rhythm is actually one of the very first signs something's wrong, and it totally explains symptoms like severe insomnia. The body literally never gets the signal to power down.
Okay, so we have our prime suspect, excess cortisol. But in medicine, a hunch just isn't enough, right? You need cold, hard proof. So let's follow the diagnostic trail and see exactly how doctors confirm their suspicions.
So this is the crucial point. How do you actually get a confession from the body? How do you definitively prove that cortisol levels are abnormally high and that you are, in fact, dealing with Cushing's syndrome? Well, it takes a series of very specific tests.
This first stage of the investigation, it relies on a few key tests. Doctors can collect all your urine over a 24-hour period to measure the total cortisol output. They can test your saliva late at night when your levels should be rock bottom, or they can do what's called a suppression test. And here's the key. To be absolutely certain of the diagnosis, they need positive results from at least 2 of these different methods.
Now, here's a point that often trips people up, so let's clear it up. Cushing syndrome is the big umbrella term. It just means you have the condition caused by too much cortisol, no matter where it's coming from. Cushing's disease, on the other hand, is super specific. It means the cause is a tumor in the pituitary gland that's pumping out too much of the signal hormone ACTH. So remember, all Cushing's disease is Cushing syndrome, but not all Cushing syndrome is Cushing's disease.
Once the diagnosis of Cushing syndrome is confirmed, we hit phase 2 of the investigation. We know what the problem is. But now we have to figure out why. Where is all this extra cortisol actually coming from? Before any complex or expensive scans, the very first step is to check for the most common cause, by a long shot, medication. See, long-term use of steroid drugs like prednisone can perfectly mimic the body's own cortisol. This is called iatrogenic Cushing's, which basically just means it's caused by a medical treatment, and you confirm it simply by looking at a patient's medication history. Okay. So if medication isn't the cause, then we know the source is endogenous. It's coming from inside the body. And as you can see here, about 70% of those cases are caused by a pituitary tumor. That's Cushing's disease, which we just talked about. The rest are pretty much split between a tumor on the adrenal gland itself, or more rarely, a tumor somewhere else in the body that's ectopically producing the signal hormone, meaning it's making it in a place it really shouldn't be.
So how do you tell those internal causes apart? The master clue is a simple blood test for that pituitary signal hormone, ACTH. Think about it. If ACTH is normal or even high, it means the pituitary or an ectopic tumor is sending out way too many signals. We call this ACTH dependent. But if the ACTH level is basically 0, undetectable, it means the adrenal gland itself has gone rogue and is making cortisol all on its own, which then tells the pituitary to shut up. This is ACTH independent. It's a really clever way to narrow down the search.
So we've confirmed the syndrome, we've identified the cause, now we're moving into the final and, let's be honest, the most important act of this whole medical drama, solving the case and actually treating the patient.
And the stakes here could not be higher. Left untreated, severe Cushing syndrome is incredibly dangerous. All the complications from diabetes, high blood pressure, infections, and heart disease, they lead to a 50% mortality rate within 5 years. This just hammers home why solving this mystery is so critical.
The treatment path is actually pretty clear. First, you have to get the patient's severe symptoms under control, usually with medications that block cortisol production. Then, the definitive treatment is surgery to remove the tumor wherever it is. And because these tumors can sometimes come back, especially the pituitary ones, lifelong follow-up and monitoring is absolutely essential.
Now, this is a fascinating little clinical pearl. It's telling us that sometimes the absence of clues is itself a clue. So when the source is a really aggressive ectopic cancer, the disease can move so fast that the patient might just have symptoms like weight loss and weakness without developing all those classic Cushing's features. So if you do see those classic signs in an ectopic case, it can actually be a good thing. It suggests the tumor is growing more slowly.
Cushing syndrome is just a perfect example of how disrupting one single hormone can send a cascade of chaos through the entire body. It's a powerful reminder of how incredibly delicate that balance is. And it kind of leaves you wondering, doesn't it? What other complex medical mysteries are unfolding all around us, just hiding in plain sight, waiting for the right clues to be pieced together?